everyone, it's Franki here, coming to you today from Commonwealth Facial Plastic Surgery in RVA. Today we're talking about microneedling with PRP, otherwise known as the vampire facial. So what is microneedling with PRP? What is it all about? Let's start with bringing your inner beauty to the surface with precision microneedling. This procedure is quick and easy with very little downtime. It works by remodeling the skin by creating temporary microscopic channels under the surface. We recommend a series of 3, spaced at just 1 month apart. PRP can also be added to your treatment. PRP is a simple blood draw that's spun to separate your red blood cells from your platelet-rich plasma. This is where we get the term vampire facial. This extracts your own growth factors, plasma, and platelets to improve and enhance the results of your healing and less downtime. Collagen and elastin are the essential protein fibers in the skin that give it support and elasticity. As we tend to age, collagen loss starts at the early age of just 25. These fibers break down, and that's what causes our wrinkles. Collagen also plays a key role in scarring, such as those resulting from acne. Skin remodeling can have an important role in improving the appearance. This simple 30-minute procedure with 20 minutes of light numbing time activates your body's natural skin healing power to increase collagen and elastin so your skin returns to a healthier looking and youthful appearance. For post-treatment, you may feel a slight sunburn feeling and your skin may appear pink to red. Your skin will continue seeing improvement over the next 3 to 6 months. You'll be given a take-home healing hydration serum and a recovery mask to use to help you through that process. I also recommend the ZO Skin Health Soothing Ointment to help with redness and irritation. If you enjoyed this video, please like, comment, and share. Follow us on social media at commonwealth.facial.plastics or visit us on our website at matthewbridgesmd.com. And we look forward to hearing from you.